Cardiomegaly. In this session, we are going to learn how to interpret enlargement of the cardiac shadow. The key finding is an increase in cardiothoracic ratio of greater than 0.5. Cardiothoracic ratio is defined as maximal cardiac diameter divided by maximal thoracic diameter. The common causes of enlarged cardiac shadow include pericardial effusion, valvular heart disease, left ventricular hypertrophy, cardiomyopathy, congenital heart disease, carpulmonale, pulmonary hypertension, congestive heart failure. There are several other reasons for enlarged cardiac shadow. We have not included those here. So these are the common causes, and we shall go into the X-rays. In this X-ray, it is very obvious that the cardiac shadow is enlarged. So basically, as per theoretical definition, what we need to look is, first we need to draw this maximal cardiac diameter, and then we have to measure the maximal thoracic diameter. So maximal thoracic diameter. Sorry, the lines are not straight. So as you measure both of these things, the cardiac diameter should be less than half of this thoracic diameter. Whenever this cardiac diameter is greater than half of the thoracic diameter, it indicates there is a cardiomegaly. So this identifying cardiomegaly is quite easy. As you get used to that, visually you should be able to identify the cardiomegaly. So there's no need to measure most of the time. But there are other features in cardiomegaly which can give us a clue regarding what is the underlying cause of this cardiomegaly. So here, if you see, there is a pulmonary artery is enlarged, so there's a pulmonary hypertension, and here this is aorta, and followed by aorta there should have been a concave pulmonary bay, so that is absent. So again, that indicates pulmonary hypertension. So aorta and pulmonary artery are contiguous to each other, and then there should be left atrial appendage that is also enlarged here. So it has a straightening of the left heart border is found. This is the left ventricle margin, right? And here in the right side, this is the right atrial margin border, and here you are seeing another density which is similar to this border but a little bit medially. This is the left atrial border. So we have this double right heart border, or the double density sign, which is found in the enlargement of left atrium. That is a common thing is the mitral stenosis. If you see the division of the trachea into right and left main bronchi, it's not very clear. Sometimes if there is a left atrial enlargement, this coronal angle is widened. So most likely this cardiomegaly patient might be having a mitral stenosis, but we can't be very sure about it just based on X-ray. We need to do an echo to confirm the diagnosis. Again, you're seeing an enlarged cardiac silhouette. So you see the maximal cardiac diameter, and then you measure the maximal thoracic diameter. If the cardiac diameter is greater than half of this thoracic diameter, then it indicates cardiomegaly. So here, a large heart. So some of the descriptions of pericardial effusion, they describe it as having a water bottle appearance. So here, this is the mouth of the water bottle. These are old water bottles, olden era, uh, some 100 BC or 200 BC water bottles, where you have straight uh, mouth, something like that, and then you have a water bottle, right? So it's a water bottle sign, or the money bag sign. So the money bag that usually olden people carry, so it should be something like this, and then here they can hold it. So So if you have a water bottle sign or a money bag sign, then it might indicate pericardial effusion, but we can't be 100% sure. You have to do an echo to confirm this thing, but based on this x-ray there might be a possibility that this patient might be having a pericardial effusion. Another thing is, in pericardial effusion the borders are quite smooth. Another x-ray, so again you have a cardiomegaly. It's very obvious this is the lung that is behind the cardiac shadow. So one another finding is, you can see this trachea up here, and then it is dividing into right and left main bronchi. You can see that the carina is widened. You have to see multiple normal x-rays and carinal angles to appreciate this thing. So the carina appears widened. So the widened carinal angle is especially due to the left atrial enlargement. Because of the pressure of the left atrium, it kinds of widens. So here another x-ray, so cardiac shadow is enlarged, and if you see carefully, this again here the carinal angle is widened. So I put up in this x-ray, so with the magnification. So this is the trachea, and then this is the right main bronchus, and this is the left main bronchus. So there's a widening, especially this left main bronchus will become much more straighter. So widening, it is because if there is a left atrial enlargement here, left atrium sits here, and because of its pressure this carina is widened. Here again there is a cardiomegaly. Now I want you to focus on this apex of this cardiomegaly. So the normally apex is down here, so here it is, the apex is a little bit shifted up. This is called this upturned apex, upturned cardiac apex. So this upturned cardiac apex and this boot shaped the cardiac shadow indicates right ventricular hypertrophy. And there is a right ventricular hypertrophy in cases like tetralogy of Fallot, so you'll have a boot shaped heart. So the boot shape in the sense that the apex is somewhere here and then it goes down here. So even here you can see this typically, the tip of the apex is here and then it goes like this, right? This is a boot shaped heart. It indicates right ventricular hypertrophy. Here the right atrium is also enlarged because there is an outpouching. So that you see the center of this spine, and so very much enlarged up here. You can see it's, there's one more measure of finding out if there is a right atrial enlargement or hypertrophy. That is the measurement from the distance from this spine. Here it's pretty distant, so there is a right atrial enlargement, right ventricular hypertrophy. So cardiomegaly is there. If you measure this maximal cardiac diameter divided by the maximal thoracic diameter, you can identify that there is a cardiomegaly. So mostly you have to identify cardiomegaly. So whether what is the underlying reason, then it's a second thing. But if there is an x-ray, always look for the cardiac shadow. Just look at the cardiac shadow and see if there is cardiomegaly or not. So conclusion, look for cardiomegaly in every chest x-ray. So we'll have a cumulative learning session. This is very important because whatever we learned in the previous session, I want to reinforce you multiple times so that you don't miss this structure and you keep remembering all these things whenever you see the x-rays. So in the first session I told you always check for the CP angle in every x-ray that you see. Second session I told you compare the right and left lung volumes in every chest x-ray. And third session I tell you never miss a straight line, it can indicate hydropneumothorax. In the fourth session, never miss a pneumothorax. In fifth section I mentioned if there is a whiteout, look for the tracheal position. If there is a whiteout, whether the trachea is in central or whether there is an ipsilateral shift or a contralateral shift, that gives you the diagnosis and the reason for the whiteout. And in this session I'm asking you to look for the cardiomegaly. Just see, there's nothing much, just see if there is cardiac enlargement, then you can say that there is a cardiomegaly, and then you can think about what could have caused the cardiomegaly. So thank you.